Well, if those aches and pains in your knees seem to be a persistent problem, suffer no more. This morning, Dr. Brad Tolin is here. He's with the San Antonio Orthopedic Group, and he is here to talk about a phenomenal new procedure that I think is going to help a lot of people. Welcome, Dr. Tolin, to Great Day SA. It's good to have you here this morning. So, as I understand, the San Antonio Orthopedic Group is currently recruiting patients for a study. Tell us about it.
Yes, this study is by Histiogenics, and it's called a NeoCart implant, and it's a type of cartilage replacement using your own cells to fight basically people that have chondral injuries, which is cartilage damage to the knee, which can be painful and problematic.
So this is so interesting. We were talking about this in our meeting. Tell us how this works. You go in and you're essentially using the patient's own tissue.
Correct. What you do is you take a biopsy of the patient's own cells, and then it's sent to Histiogenics, where it's expanded and placed on a membrane, basically a biologic membrane, as you see it in the monitor. And the cells are grown and attached to sort of this disc. This disc is then inserted into the knee, but first it goes through a process where the cells grow. It's expanded in a special bioreactor that tries to mimic the natural mechanics of the knee and also the oxygen tension. So it grows out into a matrix, which is different than some of the other cartilage
It's different
type
than some of the current
replacements.
therapies. What excites you about this for your patients?
Well, really, this is the next generation of cartilage replacement. I mean, typically when people develop cartilage damage, it can progress into arthritis. And really the only treatment for end-stage arthritis are artificial knees, which are metal and plastic. This technology potentially can hopefully avoid that process by stopping it early before the joint deteriorates.
Yeah, because once it starts deteriorating, you have that pain, you have that persistence that won't go away, and by that time the damage is generally done.
Correct.
Let's talk about this study. Who are you looking for? Who's eligible?
Well, patients are anywhere from age 18 to 55 are eligible. You have to have a knee pain, typically with swelling, locking symptoms, and we evaluate you with an MRI scan to determine if you have a chondral injury. And when I'm talking about a chondral injury, it's an injury on the cartilage on the bone. So, for instance, there's different types of cartilage in the knee. There's the meniscus cartilage, but there's cartilage injury on the bone, which is really a precursor to developing arthritis. So there are a lot of inclusion and exclusion factors, and they're listed on the website. They're too numerous to go through. But if you meet those criteria, you may be a candidate for this kind of procedure.
Wonderful. And I do want to point out that patients in each group that you select will have a specific rehabilitation plan and will be evaluated regularly for 3 years after treatment.
Right. As part of the study, there's regular and routine follow-ups to see how you're doing, up to 3 years even. So there is a process where the cartilage heals and matures, and we limit your weight bearing initially and then gradually let you weight bear, similar to some of the cartilage replacement processes out there now. Dr.
Tolin, thank you so much for bringing good information. If you think you might be eligible for a study like this and you're interested in participating, here's a phone number to call, 804-5901. That's 804-5901. Call today. That is for the NeoCart study with the San Antonio Orthopedic Group. Dr. Tolin, we appreciate you. Stay with us, everybody. We'll be right back.